Welcome to Be Well. I'm Lisa Burgaw, pharmacist, yoga teacher, and health coach. Each week, we'll explore simple, science-informed ways for us to move better, feel more resilient, and feel more at home in our bodies. From breath work and strength training to sleep, hormones, and healthy habits, we're here to help you age well and truly thrive, one small step at a time. This is Be Well.
Hi, it's Lisa Burgaw from Be Well, and I am here with my friend, Dr. Lauren Doherty, and we're going to talk about being well. We're going to talk about healthy aging and feeling good in our bodies for as long as possible. So, hi, welcome.
Hello, thank you for having me.
You're so welcome. I'm so glad that you're here.
Me too.
I'm so glad that you're here. So
I always love talking to you.
I know. We could talk for hours. We've been talking about this, trying to plan this show. How much to talk about. There's just so many things we could talk about. We really had to scale it back. But I think you'll be back. I think you'll be back for recurring episodes. So. Yeah. So thank you so much for being here. Maybe you can introduce yourself to the audience and just tell us a little bit about yourself and how you came to do what you do.
Okay. Hello, I'm Lauren Doherty. I went to medical school right from college. I kind of don't remember ever not wanting to be a doctor. I did go for thinking I was going to do OBGYN, but it became clear that I was not an OR doctor. And so I went into internal medicine, and I trained at Johns Hopkins at the Bayview campus with some of the best geriatricians around. And I learned to love most people, but I definitely had a comfort place with older folks. And actually,
they have a soft spot in my heart too, my pharmacy world.
Right?
Yeah. It's a different population, and not everybody wants to work with the elderly. I want to be the kind of elderly person that people want. You know, like when my grandmother broke her hip and she was in the nursing home, and everybody was fighting over her because she was really sweet. So I want to be that kind of old person.
Sometimes the feisty ones are more fun. I have to say, there's nothing wrong with sweet, but there's nothing wrong with a little personality and a little fight back either.
I know. And that taps right into what we want to talk about aging well. Right,
and that is part of aging well in some ways. You know, being all sweet and complacent all the time maybe isn't the way to go. No. But we do love those patients.
A little spicy, a little sassy is a great way to age.
Right.
Yeah. And I think too, sometimes we end up where we're supposed to be. You know, you think you're supposed to be somewhere. I loved saying those too. Like you think you want something and you put it out to the universe and you go, or something better. Because you never know. Like you might come up with something that ends up being like you thrive at what you do.
Oh, thank you.
Personally, I know that because my stepfather has been in her rehab center. She's the medical director at Beechwood in New London. And yeah, so if you can, I know you said that you were training under these fabulous geriatricians. And so I didn't mean to interrupt you, but tell us more.
No, so, and then we moved to this area, to New London, and I didn't work at first. And then I was a hospitalist for 10 years, something I also I didn't even know what it was when I went to medical school. And now it's become part of the medical world. Yes. But I was a hospitalist from the kind of the beginning of the hospitalist program at Lawrence Memorial. And I always worked part-time, less than full-time. Mm-hmm. And so
because you have a thriving family.
Because I have. And so in 2014, when, at the time it was IPC, Team Health, sort of decided to go into the nursing home business, they needed a doc, and they asked me to sort of temporarily fill in because my schedule allowed it.
Nice.
And temporarily, that was 12 years ago. It is who I am and always wanted to be without necessarily knowing it.
I love seeing that because I've done a lot of work in my pharmacy world with fall prevention programs and medication safety programs, and I've done a lot of work with senior resources, and a lot of my patients were elderly, and so it's nice to see that there's good docs out there. Because sometimes people feel like they get lost in the system, you know, and so I think it's really important to have good doctors out there that are taking care of maybe our elderly parents or our grandparents, and someday it's going to be us.
Someday it will hopefully be us. Yes. And aging is scary, and people have a lot of preconceptions about how they can control it, and I think that causes a lot of things. Or fight it. And
do you feel like that's more in our culture? Like we really fight it.
Right.
We were joking around before
yes.
before the camera was rolling. I was joking around going, I've earned these laugh lines.
Right, right.
And I'm okay with
and
them.
We are definitely an ageist society.
Yeah.
And I think that we do have some control over how to age, but fighting it is the problem. Totally agree with you.
Yeah, yeah. And also that defeatist attitude, or feeling like, oh, this is just part of aging. I'm old. This is normal, and sometimes it's not. You know, last week we had Manali Kadam, who's a physical therapist. She specializes in pelvic health, and she was talking about how incontinence is common, but it's not necessarily. It's not normal.
It's not normal.
And things can be done.
100%. So first of all, there's a lot that can be done to prevent it, which I won't go into because I'm sure that was what was discussed last week. But there are definitely prevention, and but there's also some cures and some ways to live with things as well, and to not seek help and to sit alone in your own world and not. And think that it's normal or part of aging or there's nothing you can do about it is a problem. And that goes for a lot of things. Incontinence, definitely one of them. Pain in joints is another one. Unsteadiness.
Yes.
And even some forgetfulness or other things. And there are things we can do to prevent it, and there are things we can do when and if they occur on how to control it.
Right, I love that. I love that. Because sometimes we get just a little fog. You know, like when I was pregnant, we used to call it placenta brain, right? I was like, oh my gosh, I can't keep anything straight. But I also had 3 kids and was working full time, and I had a lot going on and wasn't sleeping. So
that's
sleep
what I was just
is
gonna
another
say.
thing, right?
Right.
So maybe it's not dementia, maybe it is. So, getting checked out and following.
Right.
Yeah.
And so these are things I feel like we're touching on a lot of things that can help from any age. So sleep and sleep hygiene is so important. And I feel like people, when they're younger, it's almost like if you sleep that you're weak. That is ridiculous.
It was like you got a badge. I used to feel that way.
Oh, me too.
Oh, I can get by with 4 to 6 hours, and I'm a busy. I got that busy badge.
Who needs to sleep, right? I'm tired. That means I'm weak. No. There are definitely studies that if we sleep more, we will age better.
Yes.
And so let's touch on sleep. So sleep can be, first of all, the worst thing you can do is when you can't sleep is stress about the fact that you're not sleeping, right? I can't sleep.
And you're not going to sleep.
So, and that happens, by the way, it happens 1 or 2 nights. It's normal, fine.
Right.
It's continuous. And so the best way to sleep is the best way to do a lot of things. Moving, outside, routines, no caffeine. We can go on and on.
Right.
I am very much, this is like a double negative, not a proponent. I very much dislike sleep aids of any kind. I think sleeping pills are not a good thing. And I don't think they promote sleep hygiene, which is really important.
And they do affect your sleep cycles. And I do feel like they can be wonderful as an assist temporarily under supervision.
100%.
Yeah.
Again, any life be nice to yourself.
Yes.
Somebody you're very close to passes away. You're anxious about something. You're in a lot of pain from a procedure or for some reason. Anything temporarily that you can sleep with aid, 100%. I'm talking all, continuously or as part of a healing process.
Right.
No, absolutely.
And that's why even the recommendations, if you look at the package insert on sleeping pills, most of them say 14 days. That's max.
Right.
And you should be seen if you are having trouble sleeping and it's more than 14 days, then getting checked out. Maybe there's something else going on, or maybe it is a lifestyle thing and sleep hygiene could help. And I kind of feel like figuring out your sleep hygiene and creating that schedule takes effort. Right? So,
and isn't that the thing with everything?
Yeah. And it's worth it.
So starting habits, and anything that we do younger is going to help with the aging process.
Yes.
It's going to help us get older, and you continue those habits. So, and even with our kids, right? We teach them to brush their teeth to read a bedtime story, to have a bath, to whatever it is, from very young to older, people have routines.
Right.
It shouldn't stop when
And
we...
it's a process. It's not like,
Right.
okay, we're all done playing, go to bed.
Right.
You have to do that
Exactly.
wind down, and it takes some time. And I remember when my kids were small, that wind down time could be hours. You know, you start here, you have dinner, and you have a nice warm bath, and then you read, like you said. And yeah, and pampering ourselves a little bit like that too might help. Yeah.
It helps.
Yeah.
And if you don't have the time, then figuring out what is best for you. So a lot of people, you know, having that cup of coffee after dinner, maybe not. And decaf, by the way, is decaf. It's not no calf.
Right.
So
I can't have any caffeine, and I only do tea. I can't even do coffee at all. And I can't have my tea after 11 a.m.
right?
Yeah. Well,
And
caffeine has a
figuring-
very long half-life.
A very long
It's in your
half-life.
system
And
for hours.
figure out what that is for you and what that, you know, so
Right.
coffee in the morning is great.
Right.
Afternoon, not so great.
Right.
Tea is amazing, but you know, how many herbal, yummy teas are there out
Right,
there?
right.
So at night and after
Yeah.
dinner, who doesn't want
And if you're drinking
a
too
hot
many
drink?
hot teas at night, you're going to be up peeing.
Right? Also.
Right. Balance. It's all about balance.
Right. And by the way, there's nothing wrong with, and I have to give my husband credit for this because I used to tease him, but boiling water with a little bit of honey and lemon is actually really good.
Right. It is really good. It is really good.
So, and it, you know, it without any caffeine.
With no caffeine. And again, maybe that's part of your ritual too.
Right.
And that bedtime routine could become a ritual.
100%.
I feel like that's really helpful. And what I've tried to do, my morning routine is really good. It's always been really good. My evening routine, I know I do better when I sleep better.
Right.
And it does affect everything. It affects your blood pressure. It affects your heart rate variability. It affects your mood. Like there's just so much. We can do a whole episode on
It affects your kidney
just
function.
that.
It affects your memory. It affects all of that.
Right.
So yes. So sleep is important, and then things to do to sleep are also important. So moving, and we can talk about. Let's talk about moving, right?
Yes.
So no person old, whatever that is, 80, 90 years old, is going
to be 108.
You're going to be 108. No 100-year-old, as far as I've seen or know, is going to start exercising
Right.
at that age, right? So
Although it's not too late to start ever.
it's never too late to start.
But earlier better.
But and I'm picking on 80s for no specific reason, but the 80-year-olds I know, the 90-year-olds I know who are walking and moving and functioning, we're doing that at 40 and 50
Yes.
and 30 and 20. And
Training for their future selves.
100%.
Yeah.
So it's a habit that does need to start, and moving in whatever way that means. And they're absolutely, for menopausal women, pre-menopausal and postmenopausal, strength training is important.
Yes.
Because that hip fracture,
Right.
that's what can cause the demise, because hip fractures cause being in bed, cause pneumonia, cause UTIs, cause blood clots, but it also means you can't move, right? So
Right.
when you're in bed recovering from a hip fracture,
Right.
you're not moving.
What my experience has been with fall prevention, with my fall prevention projects I've worked on, is when somebody falls, then they lose confidence and then they stop doing things because they're afraid they're going to fall again. So then they lose that core stability. And so I have a friend who teaches chair yoga, and I love this story because she was talking about when she started. She had a woman in her, I would say in her 90s, and someone wheeled her in a wheelchair. And I might be saying the story wrong, and I'll have my friend correct this because she'll be on the show at some point. So she was wheeled into this chair yoga class, and she was kind of like falling asleep in the chair, like falling out of the chair, slumping, and then crying when she was awake the first time. And then, so she didn't think she was ever coming back. She comes back the next week. And she didn't cry, I don't think, the second week, but she didn't really participate, and she kind of slept through half class. The third week, she came in, she did a little bit of it, but however, only just a few weeks. And this woman was in her 90s, so it is never too late to start. She started to get just enough core stability where she could at least hold herself up in her chair and not be like slumping in her chair, falling out of the chair. And then she stayed awake for the whole class. And then she started coming in happy, looking forward to the class. So I just thought that was just so fabulous. And I've taught some chair yoga in a nursing home to 80 and 90 and 100-year-olds.
We do it.
And even just lifting their feet in the chair and creating that core stability will just keep you
All of
upright in your chair if you do have to be in a wheelchair.
Right.
Yeah.
But so let's say that again. It is never too late. It is never too late to start.
Right.
You can start at 108.
Right. It's better to start
But
earlier.
it is a lot easier to start at 100 to move at whatever age is
Yes.
the age if you had started earlier.
Correct.
And there's no question that it's easier to start walking at 20, 30, 40
Right.
than it is at 80, 90, 100,
Right.
and 50, 60 for sure.
Right.
And if one falls, which we can get to all of that, fall prevention is a whole thing, but
Yeah.
people fall.
Right.
The weather outside
it's
right
icy.
now,
Yeah, yeah.
I guarantee you people are going to fall.
Right.
No matter how active and fit they are.
Right.
If you have strength, bone strength, if your bone density is good, if you have resistance, you're less likely to break something.
Correct.
So that's what I'm
I'd like
talking
to
about.
jump in for 1 second
Sure.
on that because it just made me think of it. Because we can do the very best, but we maximize our bone density between 25 and 30 years old. That's a lot younger than people think
A
about
lot,
or
yeah,
many
right.
know, right? So maximizing your bone density. So again, starting earlier is better. Prevention is key. However, we can slow down that rate of decline. And if you have that strong muscle strength to support your bones, then even with weaker bones or thinner bones, just to be simple, you know, osteopenia, osteoporosis without getting too technical, is having that scaffolding of the musculature to hold you upright.
Right.
And also that agility and stability. So if you were to slip, you can correct it without
Exactly.
throwing out your back. And then we'd need to go see your husband. That's another story.
That's a whole other story. But how many people go? Then the other issue is, right, all your muscles and your bones and your ligaments, they're all connected, right?
Right.
So how many people go to physical therapy because their ankles hurt and the good physical therapists say to you, well, it's because of your hips. Like, what do you mean it's because of my hips,
Yeah.
right?
Yeah.
What do you mean that my posture is off because of my knees, like, or whatever,
for sure.
whatever it is,
Yeah.
right? So,
And your feet, it's literally your foundation. And people don't even think about
100%.
their feet.
So if you're moving and exercising and all the muscles that support are okay, then if you do injure a certain area,
Right.
the supporting staff is there, so to
Yes.
speak.
And then going back to the sleep, we heal when we sleep and rest, right?
100%.
So I say this in yoga all the time. Shavasana is the final relaxation pose at the end of a yoga class, and a lot of people resist it. They, I don't have time for that. And I until I understood it, I'd be like, I've got to go pick my kids up. I got to go to the grocery store. I can't just lie here and do nothing for 5 minutes.
But it's
and when I learned that the benefits of it, I like, can you give me more?
Right.
And again, I say this is where
Definitely
the
I was
magic
gonna say,
happens.
it's definitely the best part. Like,
This is where the
I love your
magic
classes, but it's definitely the best part, right?
It really is. And I say to people, this is where the healing happens. This is where the growth happens. And I think now there's so much more, especially with sleep, and not to keep harboring back to that, but I really feel like it's a foundation, is that's when your brain, it's like the rinse cycle, that glymphatic system
And what I love
is
about
amazing.
what I love about talking about sleep is if we sit here and talk about exercise or we talk about dieting or not, I forget dieting, nutrition in general. People are like, yeah, whatever.
Diet is
whatever.
what you eat.
Right.
Yeah.
But when people talk about sleep, it's like, oh, I can be nice to myself and
Yes.
sleep. Like, who doesn't like to sleep, you know?
know.
So you have to be nice to yourself.
Like
you have
no
to
little
give your
kid, they fight naps, right? But like,
Right.
no adult would be like fighting to take a nap. You're gonna put me down for a nap? Yes,
yes,
please.
So, but the point is, it doesn't make you weak. It doesn't make you a
No,
little
it makes you
kid.
stronger.
It doesn't make you. It's okay to admit that you need sleep, and if you're not sleeping, figure out what it is. And by
Yes.
the way, some people need 8 hours is an average. It's
Right.
like an average temperature of 98.6, which during
Right.
COVID we all learned is
Not real.
Not real.
Yeah.
Everyone has different temperatures,
If
right?
I'm 98.6, I have a fever. So.
Exact, right?
Yeah.
I think a lot of people figured that out. We had to have our temperature every
Yeah,
day.
yeah.
But so 8 hours is average.
Yeah.
Some people really do need 7, but some need 9
Or 10. Yeah.
or 10.
Yeah, yeah. And figuring that out.
Figure that out, and depriving yourself of that is not going to make you more productive. It's going to make you less productive.
Correct.
So
Yeah.
so sleep.
Yeah.
100%.
Yeah. And sleep deprivation affects literally every system in your body, especially cognition. So you might feel
Absolutely.
like, oh, I'm forgetting everything. But again, looking back, why?
Right.
And if you're concerned, because I know that you do have a lot of your patients have dementia or Alzheimer's.
right,
and
right.
that's something that it's scary.
It's scary.
And somewhat manageable, if you admit that you have symptoms early, if you are seen, if you have testing done, although the testing, which I'm finding, is hours and hours and hours and frustrating. So I think, again, starting earlier and seeking help, so maybe you can speak about that a little bit.
So again, with
Because we were talking about fogginess.
Right? With everything.
Yeah.
Don't put yourself in isolation.
Right.
Talk to people. So let's even step back even further than that, or more basic than that.
Okay.
In order to age gracefully, start going to the doctor early. How many people forget to go, don't have primary care doctors?
Right.
That's why the ERs are so crowded.
After their pediatrician sometimes.
After their pediatricians,
Or if they've had children,
after their
not since they had their
OB,
last child.
or
right?
whatever it is, right?
Right.
So everyone should have a primary care practitioner.
Yes.
Be that a physician assistant or an APRN or a doctor, whatever.
Okay.
Everyone should have someone who's going to be the conductor
Love it.
and take care of their body, and they should go every year.
Good.
And trust that person.
Yes.
So that's the person you tell your initial symptoms to. That's the person who should order some basic tests.
Great.
Screening, blood work, all very important. I don't want to get into that because that's
we'd be here for hours.
I can, but
Yeah,
that's
I know.
right.
That's a whole other show.
So all of that
It's
needs,
important. It's not
really,
to
really
minimize
important.
it, but there's just so many levels to that.
Right.
Yeah.
And that's the person that you can talk to about all of these things.
Yes.
So that's all the way back from there. So if you are having problems, then it's time for that person, that conductor, so to speak, to put you into the section that you need to go into and what you need to do, what
Yeah.
screening tests you need.
It's almost like
what
spokes
blood-
on a wheel.
Right.
Like the conductors here, the patient center. I love the patient center healthcare, but
100%.
patient center and their conductor. I love that. I love that. And then referring them out to
Right.
whoever's needed to
Whoever-
help on that team.
Right.
Yeah.
Whatever team is needed, or whatever tests are needed, or whatever help is needed.
Yeah.
And
That's what I think of as holistic health, by the way.
Right.
So I know some people think holistic is just, going in the forest and foraging. I don't know. I mean, like people think of different things. I think of holistic as WHO, like Ellie, like whole, the whole. The medical practitioner, the pharmacist, the yoga movement, but the patient
The
really
naturopath,
drives it.
right.
Yeah.
acupuncture,
Acupuncture,
whatever,
absolutely.
whatever you believe in, whatever is going to help you, whoever
Right.
you trust the most.
Right.
But you have to have that
Team.
You have to have that team. You have to
Yeah.
have that system.
Yeah.
Having said that, saying too many cooks spoil the soup
Yes.
kind of thing.
Yeah. You drive it.
You drive it.
And you know your body, and you
Right.
care about yourself more than anybody else. Like I used to say this to my patients all the time, like, I really care about you, but you really have to be your own advocate because
Right.
you know what's going on. And if you're not telling me,
100%.
and most people don't, right? So,
Well, you
or
have
many
to-
people
okay,
don't,
so-
or they don't think it's an important symptom.
Or they don't sit down and think about it long enough, so they
Yeah.
don't know that they do.
Yeah.
We know I truly believe that we know our own bodies. We know
Yeah.
what's going on.
Yeah.
So you have to sit down and sort of think about it. And if you can't, then find someone who's going to be able to ask the right questions
Right.
and direct you. But that's the key, right? To sort of have a health check-in
I love that.
yearly, whatever that is.
Right,
Okay.
right.
That also goes
And
for
go with your questions. Like sit down. I love that you said that. Sit down and
Right.
think about it and write down your questions because you only have so many minutes with a doctor. And part of it is just catching up. Hey, how you doing? How are the
Right,
kids? Blah, blah,
right.
blah. But that time to actually talk about what's important, you might forget, or you might get distracted. So I think going
100%.
in there with a list of questions that are important to you is helpful too.
Right. And
Yeah.
so, how am I feeling? What's my check-in? What do I need to do? What do I need to work on? And then the blood work or the screening tests or whatever,
Yeah.
and then work with what you get.
Yeah.
You get a hemoglobin A1C that's a little higher than you want it
Which
to
is
be.
blood sugar.
That's
Yeah.
right. So that's the
I say it's like the report
it's
card.
the 3-month. So it's the average 3-month sugar level of our bodies.
Yes.
Right. So it's not if you eat a Snickers and take your blood sugar, it's going to be higher than
Right.
if you just woke up
Yeah.
and okay. So
I
this
think it's
is-
like the report card for the semester. Like yeah,
Exactly.
instead of just like the quiz that you
right.
just
But
took.
some people don't want it because they're afraid. Right.
Right.
So
It's a
deal
great
with
indicator.
it.
It's a
Deal
good-
with what it is.
Yes,
Get your
yes.
cholesterol checked.
And then you can respond.
deal with it. There are
Yes.
things you can do.
Yes.
A lot of people are anti-medicine, and that's okay. But it's also okay to be on medicine. There's
Yeah.
a lot of people
Yeah.
that study medicines. Having said that, if you start a medicine when you're 40, doesn't mean you have to be on it when you're 80. You don't have to keep these medicines for the rest of your life.
No.
It's
And I love that you
okay
said
to
a
stop.
medication checkup. So it's not just a physical
Right.
checkup. And your eyes, your ears, your mammograms, your bone density, all the checkups, and a medication checkup is right up there too.
So it's okay to switch around medicines. You might need to go on more, you might need to go on less.
Yeah.
Maybe when you get to a certain point, a medicine that's gonna really affect your life in 10 years isn't necessary based on the side effect profile. All of that.
The risk versus benefit sometimes flips.
Life
it was
is
beneficial when you were younger, and now it's riskier, and the benefit no longer outweighs that risk.
So polypharmacy is a thing. It really
for sure.
is.
It has a name.
And people, and I'm not blaming healthcare providers, but you go see people and they're like, throw this medicine.
Yeah.
Sometimes it's okay to stop the medicines
Yes.
or add them or change them or do whatever. Okay.
And have somebody look at it. I agree with that. Because, that just not to interrupt you, but that just totally just put a big flag for me, because what I see is patients so you're inpatient and you're put on these medications because that's the protocol in the hospital. Then you're sent home on some of those meds. But then you go see this doctor and this doctor and this doctor and this doctor, and they all prescribe things. And nobody's looking at the whole picture. It's not like old school
Which is why you
where
need
they
the
rounded.
conductor, right?
You do need a
that one
conductor.
person. And like you said, actually, you should be that conductor. You should be
and
aware.
know who to ask,
and know
because
who to
you
ask.
may not know the answers to that,
Right.
but know who to ask. Yeah,
Right.
yeah. And a primary care doctor is your primary care, right?
Right.
Yeah.
So that's why everyone should have a primary care physician,
yeah.
practitioner.
Practitioner, yeah.
Provider, whatever word you want to use. Okay, and then you talked about hearing,
Yes.
eyesight. So we talked about sleep.
Yes.
How many people just can't hear?
Right.
And then you think that they're losing it.
Or you think it's selective hearing, because I try to tell my husband, I think maybe you should get your ears checked. And he's like, what? And then he thinks he's funny because he's telling me a joke, right? And I go, well, sometimes I think it's selective, but sometimes I think maybe you need to get your ears checked.
Well, the
But nobody
problem
does get their
is-
ears checked unless you go out and look for it.
Right, and it's
not
actually pretty easy to find an
Yeah.
audiologist, and it's really important. Because how many people they're not being able to participate in the conversation, or how many people can hear perfectly when they're like this, but you go out to dinner in certain restaurants, and
Right.
all of a sudden
There's a lot of background
there's a
noise.
lot of background noise,
And they can't hear.
And
And they're
so-
really missing out.
and they're missing out. So what happens is they start tuning out. Then they're not as connected. Now all of a sudden they're a little bit more confused. They're not participating. They're not
Right.
remembering.
Right.
Well, what came first, right?
Right.
Same thing with eyesight. A little different with eyesight, but sort of the same thing,
yeah.
right? It's
But
dangerous.
fall prevention,
I was
too.
just going to say that. So then how many people are tripping or falling?
Yes.
Why? Because they
not
they
seeing.
can't see.
Yeah, or
they
there are
don't have the
medications that cause
perception.
blurred vision. So there's all these
of that.
multifactorial things.
So these are really important,
Yeah,
right? Somehow
yeah.
people go to the dentist twice a year.
yeah,
No one thinks twice about that.
Yeah.
But
yeah.
eyesight, ear, hearing, overall body, all of that.
Yeah.
Right. So
Yeah.
these are good habits to get into, and this is going to help age and prevent
Right.
and take care of problems.
Yeah.
Don't be embarrassed. You're incontinent. Tell somebody.
Right.
Right. Tell somebody.
Right.
And then don't beat yourself up. So
Right.
if you've gained the 10 pounds, instead of being mad at yourself, and you think that taking 10 pounds is going to do something about it.
Right. I think that's important too to know with body composition, because pounds,
Right.
that's another story, and we don't have enough time to go into that too much today, but body composition, I have people say, like, I want to lose 10 pounds, or I want to lose 30 pounds. And I'm more concerned with how much of that total number is muscle, is bone, is visceral fat around your organs. That's more dangerous, right? Is water weight, like who knows, but knowing what your body composition, and there's very inexpensive body composition scales out there. So I think that's kind of more important to know what your body composition is,
100%.
because we could be skinny fat,
Right.
and not healthy. So
you know
just
how many
total
Extremely
calories.
obese patients are actually malnourished.
Yeah,
It really is
right,
true.
right.
But be nice to yourself at the same time.
Absolutely,
You know, there are
absolutely.
things that you can do. There are things that you can work on.
Right.
So those are sort
Yeah.
of the yearly things to do.
I think you've touched on so many wonderful points. Like, movement is so important, and movement is medicine. So, like, if you've got arthritis and it's starting to get harder to get up out of the chair, just being gentle with yourself, moving your body a little bit before jumping out of bed, could be just a lovely thing to do.
That's where you come in.
That's where I come in, and that's something that I learned. It was so funny. I think I read this like in Cosmo or something silly in college. Every day before you get out of bed, because we take our hands and feet for granted. And every day before you get out of bed, just move your wrists, move your feet, move your point and flex your feet, wiggle your fingers, wiggle your toes, and then get up. It takes 30 seconds. And I've done it every single day since then. And I share with so many people, and I love when they come back and say, I did that.
Right.
And it's the littlest thing. And just moving gently in the morning, small little movements. Motion is lotion, right? And movement is medicine.
And again, arthritis is a real thing, right?
Yes.
So people start not being able to use their hands, so they stop being able to do things, so they start, and it hurts. But if you start doing these things in the morning, and you start lubricating and getting the motion going and the habit forming, you're going to be able to do more.
Yeah, and I love what I hear your like underlying theme is, it's never too late, and don't give up, and be really kind to yourself, right? I think that's so important. Do you have any I know we have so many things to talk about. You have such great wisdom. I love having you here. But do you have any key takeaways that you would like to share?
I think you just said them. I mean, right? Be nice to yourself is number one. Yeah. Sleep is very important. Yeah. Baby steps and habits starting young are what's important. Yeah. And I don't know how to say this because it sounds ridiculous, but don't fight aging. Don't stress about aging. Right. Go into it. It's a privilege.
It is a privilege.
And it's fun, right?
It can be
when you
so
can
much
just
fun.
only think about think about yourself and enjoy, and you've done it. It's the winner's circle, right?
It's the winner's circle, celebrating our wisdom,
right?
And and I think you're right. It is a privilege, and it is denied to many.
And it's denied to many.
Yeah. So I just feel like staying active and being able to enjoy yourself and be in community and moving your body and feeling free and just enjoying life is just a wonderful thing that we can do, right? It's another way to stay well, and how we can be well.
Be social, be out, talk to strangers.
Yes.
Go out with friends.
Yeah.
Initiate. Don't wait for people to call you.
I love that. Thank you so much for being here. I love it. I'm definitely going to have you back multiple times because we have so many things to talk about.
Any excuse to talk to you is fun.
I love that so much. Thank you so much for tuning in. I hope that you gleaned some great information. I do have a few books that I put out that I love on healthy aging, longevity. So Outlive, Super Agers, Unbreakable. There's so many wonderful ones. And then Limitless is about your body and your brain and aging well all around. So these are just some of my favorites. Not to give you homework, but these are some really wonderful resources. They're all available on audio as well if you want to listen to them. And I think each one of these authors has a podcast too. So if you want to look into more information on healthy aging, I really encourage you to do that. And I hope that you have a wonderful week. Be well.
Thank you for joining me on Be Well. I hope today's conversation inspires at least one simple way for you to support yourself. Before you step back into your day, pause and choose one uplifting action you can gift yourself. What's your one thing going to be? Remember, small, consistent steps create meaningful change. Until next time, take a breath, take care, and be well.